Hi everyone, welcome to another edition of AI Delhi's podcast. We are here today with Professor Nathan Grills. Associate Professor Nathan Grills is a senior research associate at the Australia-India Institute in Melbourne and is also a public health physician at the Nossal Institute for Global Health at the University of Melbourne. He works in non-communicable diseases, community health and disability largely in the Indian context. He facilitates the CHGN Uttarakhand cluster of 50 community health programs which have a largely disability focus. Academically, he researches on disability measurement in India with various partners. Programmatically, he established a Samvedna community-based disability in North India. Personally, he has a child, Abby, who has a disability. He has worked in international health and development in Africa, Fiji, East Timor, PNG, Bangladesh, and Nepal. Thank you for joining us, Nathan.
Thank you for having me.
Nathan, what would you say is the state of disability inclusion in India right now, and how do you think it has improved in recent years?
Yeah, thank you for that question. We've really seen an improvement, I think, in India and their response to disability. There's an excellent policy in place. The People with Disability Act in India is an excellent act, and the current government has had a number of initiatives, including Accessible India campaign, to try and increase access for people with disability. So things are improving. There's still a long way to go, and where I work more at the grassroots in North India, there's getting access to services at those more peripheral areas is very difficult. But I think we've seen a lot of improvement from the current government in their approach to disability.
Excellent. And how do you think Australia and India can work together in this space?
We've been working closely now with the Indian government over the last 3 or 4 years in disability. My previous background, as you said in the introduction there, is working more with the community health level in disability and bringing in place programs and training activities to be able to increase the ability to respond to disability in the communities. More recently, working with the Indian government, we've been able to create an MOU with India and Australia, which was signed in the presence of the President of India when he visited Melbourne in 2018. So after that time, there's been a number of projects and activities we've been able to work with the Indian government on behalf of the University of Melbourne. But they've been very supportive of our work, and we've been able to work alongside the Department of Empowerment of People with Disability to work in areas including mental health and community disability programs and looking at the financing of disability responses. So it's been a really positive relationship. I think we, in Australia, have the National Disability Insurance Scheme, which is a flagship program. I think our expertise in disability development has been acknowledged from Australia's perspective, but also India has a lot of experience and knowledge as well. So working alongside India has been a really positive thing for us.
Lovely. And Nathan, the Minister of Social Justice and Empowerment is travelling to Australia very soon. So what do you expect from Minister Gehlot's upcoming visit to Melbourne?
Yeah, so this is really exciting. This is actually next week. He'll be travelling to Australia with a delegation. We're hoping to progress a number of areas that we've already started working in with the Indian government. I think the Minister's visit will be able to both announce those projects and take them forward to the next level. The projects that we've been discussing are including India is establishing a National Institute for Mental Health Rehabilitation and Research, and University of Melbourne has a lot of expertise in mental health, and we're looking at how we can work more closely together as they start that institute and help with training faculty, training leaders for that institute, and be able to help with some of the research questions that they're asking to bring University of Melbourne's expertise into that space and work alongside our counterparts here. That's one program. The other one is the community-based inclusive development program, which is a program that we're developing with the Indian government to train community-level workers in how they can respond to disability from the community level. In a place like India, even in Australia, finding therapists and professionals to go and work in rural Australia or in India, rural India, is very difficult. So we've been training people from the community to have the basic level of skills to be able to respond to people's needs and disability, advocate for them. So we've worked with the Indian government to help establish this course with the Rehabilitation Council of India. And that course is going to be launched for the ministers there, and we're hoping it will be rolled out in the coming year. And we'll be evaluating that course from Melbourne University's point of view. The third area that we're hoping that the Minister will be able to progress more is around leadership and disability. And we're going to develop a joint leadership course with India to help train leaders from India and Australia in disability, which will be facilitated through Professor Rob Moody at the University of Melbourne. The final area is around looking at financing and disability. Australia's experience in the National Disability Insurance Scheme has shown how we can roll out quite a big program across the whole country to facilitate people to get access to services through an insurance model. For India, though, we're looking at how can we make a case for investing in disability. We believe that when you put money into disability and you equip people, empower them, that they contribute positively back to the economy, back to the society. So we're working with the Indian government to do a cost-benefit analysis of what the output is from investing in disability in India, and we're doing some modelling work with the Indian government and our partners in India to be able to show that if a government does invest in disability, yes, it's good for that person with disability, but it's actually good for the whole society and for the productivity of the whole country.
Excellent. Excellent steps, all of them. And what would you say is the role of technology and innovation in this area?
Yeah, it's limitless, I think, and that's what the new way forward in disability is going to require technology to be at the fore of any solutions. Obviously, one is around smartphones and the increasing prevalence of those across a place like India, but in Australia, there's nearly universal, 80-85% of people have smartphones. So we're seeing in sensory disabilities like in vision and hearing disorders, smartphones are becoming quite central to people being able to communicate, to be able to interpret what's been said. And I think that the same thing will happen in India, where you've got a very growing technology sector, but also growing access to smartphones. We're doing one project with counterparts in Kerala looking at how to use smartphones to be able to increase access to services to people with disability. So in effect, being a social worker, someone who links people together, but allowing the app and the app-based program to be able to link people to the services that are around locally, to be able to provide basic service advice on different disabilities. But that's something we're developing with our partners in Kerala. We hope that can be rolled out right across India. And even in Australia, we're increasingly having to rely, especially in rural areas, to get services to people in rural areas. Apps and mobile phone technology is a key way to do that. So yeah, we hope after this research is done, it's largely working with carers and people with disability and their network, their family. How does the smartphone, how does an app help them to be able to network locally, get access to services, and basically able to get better care for their needs using the app.
Fantastic. I think that's a pretty good snapshot of how India and Australia are working together in disability and inclusion. And with that, I'd like to thank Professor Nathan Grills for joining us, and thank you everyone for tuning in. Thank you.
Thank you.